Yeah, to talk about growth. So from that position, you then shifted into the position of president and CEO of ASPPH. How did you step into this role, and what have been your biggest priorities?
Thank you, Mari. Oh, well, that's really, for me, a fascinating story because let me tell you, in 2005, when I was just, hired to be the dean at School of Public Health, the very first thing that I said is like, oh, you know what? We need to have the international accreditation in the United States, right? So I came in 2005 to CIF, the accreditation body, and to ASPPH to
Mhm.
say, hey, this is the Mexican School of Public Health that, by the way, it has 100 years old. It is one. It is the biggest, the most prestigious university in Latin America, our School of Public Health. So they both of them said, you know what? We don't accredit international schools. We are just a national. And I was like so intrigued. I was like, what? But public health is global health. What do you mean you don't? So I said, no, our bylaws would not allow us to do that. And I was okay. I said, well, I think that you have to change your bylaws, right? So 2 years after that, they called me and they say, "Hey, Laura, you know what? We changed our bylaws, so now you can you can start the process." And I was really so we started the process and we got the accreditation. So proudly, we were the first school of public health outside the United States, to have the accreditation with CIF, and then we belong to ASPPH. And then how many years? Like 17 years after that, here I am, being the president of the same association that at that time they said that they do not have, this accreditation for schools outside the United States. So that has been an incredible, even there, that journey, of course. And right now, I have been here for almost 8 years now. Very incredible journey here in these almost 8 years. The staff that we have here in ASPPH is an incredible, so committed, so professional. It's just outstanding. And just being able to be just working with all the deans, with all the program directors, all our community here is incredible. And of course, you know me now by now, I think. So of course the global engagement has grown. So now we have members in 7 countries. So we're very proud to have those international connections. But you asked me about what are our some of our priorities, and of course we're working in several of them. Like 4 years ago, we actually developed our strategic framework 2030. So we are very committed to our strategic framework with very specific goals. But just to name some of them, of course, transforming academia for inclusive excellence is one of the main things that we do because we are in the business of education, right? And we want our schools to have the graduates that represent the communities they served, right? So we are very into inclusive excellence to make sure we have the students and we have the faculty and we have the graduates that represent really all our communities. We are developing the public health workforce. So we launched a few years ago the public health workforce at ASPPH, which has been targeting to really offer development opportunities for the workforce. We also embrace technology and innovation in education. So we are very serious about that and really to be there centering and giving guidelines to all our members in order to how to use now the AI and other technology in education. We also are advancing solutions to the most pressing topics of public health with all our members. Some of those topics include gun violence prevention, climate change and health, healthy longevity, and advocating for public health funding. So those are just some of our priorities. Our community right now is composed of 155 schools and programs of public health. So we represent more than 13,000 faculty members, more than 90,000 students here. So we are a very powerful association and happy to work with all our partners here and globally as well. So that's some of the things that we're doing right now, Omar.
And thank you so much for also highlighting, and I appreciate that y'all are doing the work to connect people from the community and get them educated so that they can go back to the community? Because I think that that's a big part of this work that we often miss or neglect
Yeah,
is just the power of those people in those spaces to develop the skill sets and then go back and transform the communities is something that
exactly.
we need more of.
Exactly.
What do you like most about your work?
Ooh. What do I like more? Well, I can say two things. I love working with my community. Our public health community is awesome. It's the best. Those are our colleagues, our partners, our friends, really, who are so committed to improving the lives of all communities. So it's the best people ever. So I love to work with the community. I also like that we're a mission-driven profession. Our profession is a calling. It's really a mission. It's not a work. It's something that you do because it's passion about it. That really motivates me like every day. It's just to remind us the why we do what we do. And we think about the well-being and the health of everyone in this world. Oh my God, that's big. That's huge. So yeah, that's the two things that I really love about my work.
And what is most challenging?
Ooh, most challenging. Well, right now, I think that most challenging are the lack of understanding of what we do. I think the miscommunication around public health is heartbreaking. That's a big challenge. And that's something that we need to really tackle really strategically, firmly, and definitely, because that is hurting us so much. And that is not fair. Everything that we do is just so to the benefits of everyone everywhere that we need to communicate better the stories and, what we do.
Yeah, and I think that is also very important, especially in today's context. I know that some people might have seen that Facebook or Meta has taken down like the content regulation, the mechanisms that they had in place there. So there's going to be more spread of misinformation, and I think to that point, more
Yeah.
importance to have public health and the narratives of public health to be really shared.
Exactly. No, absolutely. We do really this. This is a multinational, multi-level strategy that we all need to engage in order to really fix this. Yeah,
Absolutely.